Welcome. We're going to begin with the chai.
Okay, good morning in the US and good evening in Israel. My name is Itai Jetelny. I'm the partner leading the global incentives for the Israeli office. I'm here with Shelly Dimon from our team. We really welcome Senator Coons and Holland Knight law firm in this interesting discussion. We thought that it's very important for us to expose this information and to our clients, and we really welcome and thank you all for joining the conversation. And I think, Ron, you'll present your colleagues and also Senator Kuhn and take the discussion forward.
Very good. Itai, thank you very much, and I want to welcome all of our participants this evening and this morning in the United States. We are very happy at Holland & Knight to be partnering with Ernst & Young, EY, Itai and Shelley, our guests and our co-sponsors here. We thought this would be a good opportunity to speak to people about the opportunities that COVID-19, of course, is a tremendous healthcare, public health challenge around the world, and the great things that Israeli companies and US companies are doing together. And we have a very special guest I'm going to introduce in 1 minute, Senator Coons, who is an absolute leader in the relationship between Israel and the United States in general in so many strategic points, but has also taken on even an equally important level of trying to create collaboration. And I'll explain that in 1 second. I'm a partner at Holland & Knight, a law firm in the United States of 1,400 lawyers and 28 offices in Washington, New York, California, Texas, and many other places. I'm a former member of Congress from the United States from Florida and served on foreign affairs and worked very closely with Israel. And the love of the importance of the strategic relationship between Israel and the United States and our businesses and our families and communities are very, very important to me and to all of us here. I'm here with Maytel Stavinsky, who is a co-chair of the program, and she's going to speak in a couple of minutes. We believe in the importance of innovation, of course, and Israel and the United States, whether it's pharma, whether it's medical devices, whether it's PPE, protective gear for COVID, whether it's cybersecurity, all sorts of different things are being developed as we speak in Israel and the United States. And we thought it would be a great opportunity because we work so closely with businesses for the last 25 years in Israel in dealing with the fact that they want to come to the US and access US markets. In this moment in time when there's going to be great needs in both present and the near future, we feel it's essential for there to be opportunities to exploit this business collaboration. And that's what we're here to talk about today, how to do it, how you can get into the US market. But the beginning of our program today is we thought it'd be very important to have Senator Coons, as I said, who is a leading proponent of the relationship and collaboration and security interests and economic interests between Israel and the United States. Senator Coons is a senator from Delaware since 2010. He serves on an incredible number of important committees, including foreign affairs, foreign relations, and appropriations, and many others. He's been honored as being one of the 3 most effective members out of the full 100 in the United States Senate, bipartisan, get it done person. And that's his reputation. That's why we enjoy working with him. He's a personal friend as well. I had the opportunity of working with him in the past and serving with him. And he's worked most importantly on a very relevant bill right now. It's a bipartisan piece of legislation which encourages collaboration between Israel and the United States. And I'm going to turn it over to the senator to explain what he's doing. And again, we want to thank you for your leadership on many issues in the United States and Israel. So I'm going to turn it over to you. Thank you, Senator.
Thank you, Ron. And my thanks to you, Ron, as a former member of Congress and a great friend. My thanks to Holland & Knight, to Ernst & Young, as well as to the Israel-America Chamber of Commerce. Thank you to all the hosts, to everybody who's on today. I hope you and your families are staying safe and well in this moment, this global pandemic that has challenged so many of our countries. The only way that we will get through this pandemic is through global cooperation, innovation to find solutions, as Ron mentioned, in the areas of medical devices, pharmaceuticals, PPE. Israel has one of the world's most innovative economies. And I have long treasured the bipartisan basis of the strong US-Israel relationship. And so thought that this was a great way for us to signal the enthusiasm that is here in the Senate on a bipartisan basis for working between the United States and Israel to innovate solutions to this pandemic. The specific bill that Senator Cruz and I introduced last month with 6 other bipartisan colleagues of ours here in the Senate would provide $12 million. It's $4 million a year over 3 years, with a match from Israel and the United States each contributing to joint innovation efforts that would accelerate our partnerships to find solutions that can help the entire world combat this pandemic. It was offered as an amendment to a bill that Senator Rubio and I have been leading, the U.S.-Israel Security Assistance Authorization Act, which authorizes the 10-year MOU of U.S.-Israel defense and security and development cooperation. And both the amendment and the bill passed through the Foreign Relations Committee with overwhelming bipartisan support. And I think it is just one way for us to demonstrate not just our very specific and focused interest in research cooperation, but our ability to come together around sustained bipartisan issues. Some of you may have noticed in the United States, our politics have gotten pretty sharp and pretty partisan. There's other things dividing us. Senator Cruz and I certainly don't agree on lots of topics. In fact, I'm going to a hearing right now where I know we're going to be disagreeing vigorously. But when there are issues that can bring us together, like addressing police community relations in our country, addressing the needs of our whole world for solutions to this pandemic, and sustaining the bipartisan nature of the U.S.-Israel relationship, even otherwise partisan warriors like Senator Cruz and I are able to come together and do something positive. So thank you, Ron, and thank you, Holland and Knight, Ernst & Young, and the Chamber for hosting this webinar this morning. Thank you for your interest in contributing of your skill and attention and engagement. And I'm optimistic that the innovative and sustained partnership between the United States and Israel can help us find a way forward together.
And thank you, Senator Coons, for your inspiring introductory remarks and your steadfast leadership on the importance of the U.S.-Israel relationship.
Thank you all.
Thank you. There are many, as the Senator mentioned, as Ron mentioned, there are many innovative Israeli companies with solutions to tackle COVID-19. Some already working in the U.S. Should the bill Senator Coons sponsored is enacted, these companies could possibly use it as a vehicle to support their collaboration with their U.S. partners. I'll just give a couple examples. Stratasys, a global leader in 3D printing technology with headquarters both in Israel and Minnesota. As soon as the pandemic unfolded, Stratasys formed a coalition with leading U.S. partners, private companies such as Boeing, General Atomics, and academic institutions with one goal: help relieve the strains on the personal protection equipment and respirator component in the U.S. As of today, the coalition printed over 100,000 face shields. Another example is Nitira, a developer of contactless and remote vital signs monitoring technologies. The outbreak heightened the need for symptom screening at key public locations such as hospitals, airport, workplace, as well as the need for remote patient monitoring at home. Nitira's solution provide real-time output, screening of vital signs such as heart and respiration rate, depth, and occupancy. And with that, I will now, with your permission, switch to Hebrew for just a few minutes to give a brief general overview of the issues that will be discussed during the webinar today. אוקיי, אז רק ככה לתת באמת מסגרת לדיון היום. מאז תחילת חודש מרץ, בתגובה להתפרצות המגפה, הממשל הפדרלי בארצות הברית נקט בשורת צעדים, שמטרתם מתן תמיכה למדינות בארצות הברית ולתושבים. ובמקביל, מתן עידוד לפיתוח פתרונות חדשים להתמודדות עם הנגיף. הקונגרס האמריקני נכון להיום חוקק 3 חוקי תמריצים שנאמדים בלמעלה מ$2 טריליון. חוק תמריצים רביעי נמצא בשלב זה בדיונים בקונגרס. ובמהלך הוובינר שותפיי התייחסו לחוקי התמריצים, כמו ה-CARES Act ואחרים. בין היתר, חוקי התמריצים מקצים מיליארדי ומיליוני דולרים לסוכנויות פדרליות שונות למימון תוכניות שמטרתן מצד אחד רכישה של ציוד ופתרונות קיימים, מצד שני פיתוח פתרונות חדשים להתמודדות עם הנגיף. חלק מהתוכניות יהיו ממומנות למספר שנים, עד 2023. חשוב לזכור שמדובר במימון מכספי משלמי המיסים, ולכן למשל חלק מהתוכניות מתנות הרכישה או קבלת מענקים בייצור מקומי. בארצות הברית על ידי או החברה שמבקשת את המענק או על ידי שותף מקומי. בנוסף, הפתרונות שיפותחו בתמיכת המענקים יהיו צריכים להיות מתומחרים באופן סביר והוגן, וזמינים לרכישה גם על ידי הציבור האמריקני וגם על ידי הממשל. עכשיו, למרות שבמשך עשורים רבים הממשל הפדרלי נערך להתמודדות עם אסונות טבע, מתקפות טרור, לוחמה ביולוגית ואיומים אחרים, הצורך להיערכות לפריצת מגפה לא הייתה איום שנלקח בחשבון. אז עכשיו, עוזר המזכיר להיערכות ותגובה במשרד הבריאות האמריקאי, האספרה, אמון על הובלת המאמצים לציוד ה-Strategic National Stockpile, המצבור הלאומי. המטרה היא לתת מענה לחוסרים קיימים כיום בנושא הנגיף. חשוב לשים לב שיש גם חשיבה ארוכת טווח, שמבוססת על הפקת לקחים ונקיטת צעדים להיערכות עתידית, ולכן גם יש מחשבה על איך ניתן להיערך ולרכוש פתרונות לעתיד. הסוכנות הפדרלית לניהול במצבי חירום פימה והסוכנות ללוגיסטיקה ביטחונית ממלאות תפקיד ברכישה והספקה של ציוד רפואי. ויש גם סוכנויות אחרות, כמו למשל מינהל הבריאות של יוצאי הצבא האמריקאי, ה-VHS, מובילים מאמצים דומים. שותפי איתן ירחיב ויפרט את התוכניות שחשבנו שיהיו בעיקר מעניינות עבורכם. איתן גם ירחיב ויפרט בנושא המענקים למחקר ופיתוח שחשבנו שתמצאו בהם עניין. כך למשל הוא התייחס לרשות למחקר ופיתוח ביומדיקל מתקדם, ברדה. ברדה היא חטיבה במשרד הבריאות האמריקאי תחת אספרה, וברדה מובילה מהלכים למחקר ופיתוח חיסונים, תרופות ואמצעי אבחון. אוקיי, אז אם על בסיס ידע קודם או התיאור הקצר שנתתי, כבר אומרים יופי, נשמע מעניין, בואו נלמד עוד קצת, במהלך הוובינר נתקדם ונגיש הצעה. אז כמה שיקולים שכדאי לקחת בחשבון. קודם כל, שאלה מאוד חשובה לשאול ישר בהתחלה היא, האם השוק האמריקאי הוא באמת שוק יעד חשוב, שבו החברה שלכם רוצה להרחיב פעילות? כשמדובר לבקשה, למשל למענק פדרלי, ההסתכלות על המענק לא צריכה להיות רק כספי, שלא יגדילו החזקות בחברה. ההסתכלות צריכה להיות יותר אסטרטגית. צריך להסתכל על זה ככלי כניסה לביסוס מעמד בשוק האמריקאי, קבלת ולידציה, מגוף ממשלתי מוערך שבחר בחברה שלכם על פני חברות אחרות למתן המענק. ברור שהאלמנט הכספי הוא חשוב, אך זה הבונוס ולא העיקר. צריך להבין שלא מדובר פה בתהליכים פשוטים, אלה תהליכים שידרשו מכם להשקיע זמן ומשאבים, וגם כשתקבלו את המענק יושתו עליכם חובות דיווח תקופתיות, כך שבאמת צריך להסתכל על המכלול, ורק אז לקבל החלטה אם זה הכיוון הנכון עבורכם. עוד שיקול זה אישורים הרגולטוריים. אחת השאלות הראשונות שתשאלו על ידי הסוכניות הפדרליות, היא האם למוצר שלכם יש את האישורים הרגולטוריים שדרושים בארצות הברית. ואם לא, האם אתם בתהליך לקבל את אותם האישורים? בענף הרפואה, הגוף הרגולטורי המרכזי הוא מינהל התרופות האמריקאי, ה-FDA. שותפי מייקל ירחיב ויפרט על האישורים והתהליכים שייתכן שתידרשו להם. מייקל גם יסביר על תהליך לקבלת אישור לשימוש בשעת חירום, ה-EUA. מדובר באישור מיוחד ומזורז שמיועד לחברות שלהן פתרונות להתמודדות עם הנגיף כעת. אוקיי, אז איך מוצאים את ההזדמנויות למימון הפדרלי שרלוונטי לכם? התשובה, כמו להרבה שאלות טובות בחיים, זה מורכב. נדרשת לכך הבנה עמוקה של התוכניות והמטרות של הסוכניות שמנהלות אותן. על פי רוב תידרש גם עבודת הכנה ופגישה מקדימה לפני הפרסום של הקול קורא עם אותם הפקידים שמנהלים את התוכניות הרלוונטיות. צריך לקחת בחשבון שהפקידים יודעים שיש בעיה וצריך למצוא לה פתרון. הם לא יודעים שישנה חברה בישראל שעובדת עכשיו על איזשהו פתרון מבריק, מזווית שהם לא חשבו שהיא אפשרית, ומכיוון שהם לא חשבו על כך ולא יודעים על זה, ייתכן שכשיתפרסם הקול קורא, התנאים להתמודדות לא יהיו מספיק רחבים כדי לקבל גם את הפתרונות שלכם. מעבר, פעמים רבות הדרך מועדפת כדי להעלות סיכויי הזכייה, תהיה דווקא הגשת בקשה עם שותף אמריקאי מקומי. זה יכול להיות מוסד אקדמי, או כמו שציינתי קודם, חברה פרטית שיש לה יכולות ייצור מקומי. וגם לצורך כך יש את ההיערכות, כי אם תחכו, כשהקול הקורא יתפרסם, ייתכן שכבר לא יהיה לכם זמן מספיק כדי למצוא את השותפים שמתאימים. ועוד משהו אחרון שכדאי לקחת בחשבון, זה נושא הלובינג בארצות הברית. כדי שהפגישה שלכם עם הפקיד שמנהל את התוכנית תהיה אפקטיבית, מהלך לוביסטי להעלאת הפרופיל של החברה שלכם, זה משהו שכדאי לשקול. כך למשל, אם הפנייה לסוכנות תעשה בתמיכה של חבר קונגרס למשל, שמשרת בוועדה, שמונה על עבודת אותה הסוכנות או הנושאים בהם היא מטפלת, או נגיד חבר קונגרס שבמחוז שאותו הוא מייצג, נמצא המשרד שלכם בארצות הברית. ייתכן שההתייחסות תהיה שונה. לובינג בארץ, דעת, זו מילה גסה. בארצות הברית מדובר בתהליך מקובל שאותו מובילות חברות רבות. יחד עם זאת, חשוב מאוד לשים לב, זהו תהליך שחלה עליו רגולציה ופיקוח כבד ויש חובות דיווח שונות, וגם לכך חשוב להיות מודעים ולוודא שפועלים בהתאם לכללים. זה ככה כמה טיפים. And now I will switch back to English and ask my partner, Ethan Jorgensen-Erp, to please start his presentation.
Thanks so much, Maytal, for that really informative introduction. So I'm just going to quickly go through a few of the agencies and vehicles that are most relevant, we believe at this point in time, to companies who are developing innovative technologies that could address the COVID-19 pandemic. The U.S. has for years looked to Israel for their innovation in the technology space, and this is a really good opportunity for companies with new technology that could be applicable in this space, not just directly patient to patient, but really anything to deal with the COVID-19 pandemic. And so I just wanted to provide a bit of a roadmap for you to let you know what sort of opportunities are out there. So as you can imagine, a great deal of the response has come from the Department of Health and Human Services. That's the main agency in the United States that oversees healthcare in general. And there are other healthcare functions outside of HHS, but they're really the main one. And within the Department of Health and Human Services, there is a person in an office, the Assistant Secretary for Preparedness and Response, that oversees any of the pandemic capabilities that HHS organizes. This is a relatively new office. It was created in 2006 in the wake of what was then Hurricane Katrina, which was a major natural disaster that happened in the United States. And due to that particular disaster, HHS started to reorganize its functions to create a single office that would organize any sort of support for a pandemic or other type of disaster. And within ASPR, they not only control their own contract vehicles, they also oversee something called the Biomedical Advanced Research and Development Authority. That's also known as Barda. I'm sure many of you have seen Barda in the news. If you've kept track at all of what's happening in the United States, there have been a number of vaccine candidates that have been funded directly through Barda and their contract vehicles. Barda, most importantly, oversees something called the Strategic National Stockpile. That was something that was created actually in the late 1990s, so it's a bit older than the ASPR office. It was originally designed to stockpile essential medicines, vaccines, and other countermeasures, originally designed for viral threats, but also for any sort of chemical, biological, or nuclear incident. So it wasn't necessarily designed with a virus in mind, but that is one of its main functions. And what the US government right now is trying to do is increase the capacity of that stockpile while also providing grant funding for new innovative technologies to help address the pandemic right now. That's not only vaccine development, but it's also creating personal protective equipment. So those are face shields, masks, and the like, so that people in the healthcare setting who are treating patients with COVID-19 are able to function properly. And as Maytal mentioned, through multiple legislative vehicles, there has been tens, if not hundreds of billions of dollars that has been provided for these functions in the past 3 or 4 months, which is unprecedented in the history of the US. Typically, you don't see multi-trillion-dollar pieces of legislation, but we're seeing that now. Within the Assistant Secretary for Preparedness and Response's office, they have sub-offices that are very helpful for providing new and innovative solutions for technology. That includes the Office of Acquisitions Management, Contracts and Grants, as well as their office that governs finance and human capital. So those are really the offices that help move resources from one place to another, while also providing what we typically call something called a broad agency announcement. So a BAA is essentially an overall application. So you provide information into this application, and then entities like Barda are able to take your information in and figure out where to plug you in, as well as what type of funding stream is most appropriate for you. I do want to emphasize that most of the news has been around vaccine candidates and what Barda has done there. They've also issued contracts around essential medicines. So those are sterile injectable drugs and others that could be used within the strategic national stockpile to treat a large number of patients. But Barda has been issuing contract vehicles for years on a number of different technologies, different therapeutics, ventilator technology, even diagnostic support tools. So using artificial intelligence to figure out how to more quickly diagnose patients who may have COVID. So that's a very important vehicle, I think, for a number of the innovative companies over in Israel that are developing these types of technologies. This is something that can be pretty complicated. As you can imagine, the Assistant Secretary's office is dealing with a high number of meeting requests and a number of contract vehicles. And so what we do over at Holland Tonight is help people navigate that process. That just quickly covers what the Health and Human Services Department is doing around this. It's something that I think is shifting, but those seem to be some basic responsibilities there. Another thing that we should quickly mention is the military medical system. So that's not only the Department of Veterans Affairs, which deals with the healthcare of returned veterans from the military, but also the Department of Defense. As you can imagine, the US Department of Defense has their own separate funding stream, as they have for years. They specialize in moving material from one place to another, not just for deployed soldiers, but also within the continental United States. And they're also, as you can imagine, extremely used to dealing with other countries, creating contracts there, and importing new technology that comes from outside of the US, so it can be incorporated into the military system. The Veterans Health Administration, which is part of the Department of Veterans Affairs, has been seen for years as a very innovative agency. Typically, when you think of a new healthcare model, it's something that was piloted at the Veterans Health Administration. And so they obviously have a number of procurement vehicles for new technology. Typically that works at a regional or state level. So there are people in the Midwest, in the East Coast and the West Coast that help organize that procurement. And a lot of that is responding to their particular requests for new technology, and then also having conversations with those individuals who can help then route you to the proper contract vehicle. They also have developed something called the innovation ecosystem. This is something that's been used most recently to partner with industry and the Veterans Health Administration to, for instance, increase the use of additive technology such as 3D printing, so that you can print new personal protective equipment and other components of medical products. That's something where you can have a conversation with them. They will then partner with you as a company, find out more about your tech and how you can work with the Department of Veterans Affairs in a collaborative manner to make that technology part of the COVID response. As I mentioned, the Department of Defense has had an increasing level of participation in the COVID response. It's not only DoD, but within that, the Defense Logistics Agency. The DoD has something called the Joint Acquisition Task Force, which has opened a number of portals for businesses who can provide personal protective equipment and other services. So it's not just the equipment, but also the services of being able to move various materials around, as well as other innovative technology. Because the DoD is so used to procuring new technology through contract vehicles, they're increasingly looked to as a lead agency in the COVID response. Just very quickly, but a couple of other agencies to mention that I think are important. One is the Federal Emergency Management Agency, which is something Maytal mentioned, also known as FEMA. FEMA was born out of the Hurricane Katrina disaster as well. It's part of the Department of Homeland Security, and it specializes in working with governors in the various 50 states to move material to respond to disasters. Now, historically, FEMA has only responded to natural disasters, so that's earthquakes, hurricanes, and the like. But because of their facility with disaster response, they were tapped first to do the COVID-19 response. It's an important way to converse with the 50 states. So if you can work with FEMA, they can help put you in touch with the governors of the states who can then procure technology and disperse it throughout their state. So that's an important opening there. Hurricane season is almost on us in the United States, and so FEMA is now starting to transition to its original responsibility around hurricane and earthquake response, but they will continue to have a responsibility there. And then Michael, who's going to present right after me on the FDA. The FDA has its own division of acquisition programs, and so in addition to the regulatory environment that he's going to cover, they also have vehicles where they will issue a request for proposal for new technology, and they will help partner with you to acquire that technology and then disperse it. So they're not just a regulatory agency, they do have some procurement responsibilities. So just wanted to provide that quick overview of some of the grants and acquisition vehicles that are present in the United States. And now I'd like to turn it over to Michael Werner, who's a partner at Holland & Knight, to discuss the FDA regulatory environment and how it might apply to your particular businesses.
Thanks, Ethan, and good morning, everybody. I'm going to talk a little bit about, you know what, hold on a second. I'm sorry, there's an echo. Can everybody hear me now? Okay, I'm sorry, there was a little bit of an echo. So I'm going to talk about the regulatory process in the United States for COVID applicable products. Typically, we're talking about medical devices, though not exclusively. I'm going to talk about the fact that there's basically 3 ways to get products to the market in the United States right now that manufacturers and distributors need to be aware of. So the first one is called emergency use authorization. So it's important to remember that products like surgical masks or gowns or diagnostic tests or ventilators or any of the kinds of products that might have COVID applicability, unless you're talking about a drug or a vaccine, any of these other products are regulated as medical devices by the US Food and Drug Administration. And for that reason, manufacturers who want to market their product in the United States have to comply with FDA rules for such medical devices. And if the product is manufactured outside the United States, that means that just like with all medical devices, the manufacturing facility has to be registered with the FDA, the product has to be listed, you have to get it through customs at the port in the United States, and then it gets distributed throughout the country. What's different about the COVID situation is that the FDA has created 2 additional ways that products can get to market in the short term in acknowledgement of the fact that we're in the middle of a healthcare pandemic. So that's what I wanted to talk to you about today, is these 2, in particular, these 2 new pathways. And what's important about them is that what they mean as a practical matter is that manufacturers do not have to comply with all of the typical regulatory requirements that a medical device manufacturer would have to comply with were we in, let's call it, a typical situation. So it's an opportunity for manufacturers to get their product into the United States, to get it lawfully marketed, even though it's not yet approved, while you go ahead and work on your approval for long-term marketability. So it's a way to get your product into the United States and on the market quickly in the context of the COVID pandemic. So there's two main ways to do that, generally speaking. One is the so-called emergency use authorization process. This is a process that was actually created several years ago. It basically says that once the HHS secretary has ruled that a public health emergency exists, products can be granted this emergency use authorization, even though they are currently unapproved, or it can be an approved product for an unapproved indication. But it has to be a so-called medical countermeasure, which is to say it's designed specifically to combat a biological or a chemical threat. So it has to be effective in diagnosing and preventing a disease or condition caused by the threat, and the known and potential benefits of the use of the product have to outweigh its known and potential risks. So FDA has established so-called EUA, emergency use authorization pathways, for PPE, for ventilators, and for diagnostic tests. You would have to submit certain information to the FDA to meet the burden that I described. The difference is twofold. One is that FDA gives these a very fast turnaround. They provide a template for how to submit the application. They give a very fast turnaround, usually within weeks. Two, for many of these products, there's a so-called pre-EUA process, whereby the manufacturer submits information to the FDA, and the FDA provides feedback about whether or not the company has provided sufficient data to meet its burden under this pathway. So the manufacturer gets very fast feedback from the agency. You know whether or not you're on the right track. Assuming you're on the right track, the FDA turns around your application, as I said, within a matter of weeks. And that allows you to market a product in the United States that would otherwise not be allowed. So you can get it through customs, you can import it and distribute it in the United States. Now, typically under an EUA, the FDA will impose some limitations on marketing and distribution. So for example, you'd have to label the product that it's not currently approved by the FDA, it's just on the market under this emergency use authorization, things like that that are product dependent. So you don't get complete carte blanche, but you do get the opportunity to get your product on the market in the United States without having to go through the full, for example, 510K clearance process. The other pathway that I want to mention quickly is that FDA has announced so-called enforcement discretion policy for many of these products. So hand sanitizer is a great example of that. There's also enforcement discretion policies for masks. And what basically that means is that the literal language FDA uses is they, quote, will not object, unquote, to the marketing of these products under certain conditions. Again, they don't have to be approved. They're not all of FDA's typical regulatory requirements don't apply. It really depends on the product, how the specific requirements, but suffice to say, it's another way to get your product to the market. Now, just as with the emergency use authorization, you have to be very careful about how you label and package your product in order to fall under this enforcement discretion policy. And the key when you're thinking about it is what is the intended use of the product? So a great example is in the context of masks. Is the product a mask to be used in a medical setting, for example, or is it for industrial use? If it's not going to be used in a medical setting, if it's not for a medical purpose, then FDA won't regulate the product at all because they'll say it's not a medical device. But in order to meet that standard, your label, your packaging, your marketing, your website, all have to be very clear that you're not marketing this product for medical purposes. So that's just a very general example about how you could get a product to the market in the United States through this enforcement discretion policy, but you're just going to have to be careful that you meet the legal guardrails that FDA establishes. And then, of course, finally, you could get your product to the market in the US through the regular order. You could submit a 510K, for example, if you're talking about a medical device. Note that the emergency use authorization and the enforcement discretion policies only exist in the context of the pandemic as is currently declared by the government of the United States. So once the government declares that the pandemic is over, whenever that is, any product that came to market using the emergency use authorization or through FDA's discretion, enforcement discretion policy is no longer lawfully marketed in the United States as a matter of law. Now, is FDA going to immediately say, you know, we're going to take you, we're going to send you, we're going to ban your product, we're going to seize your product? Probably not. But the fact is that in order to remain on the market, you're going to need to, at that point, meet all of FDA's regulatory requirements for such products. So for example, you might need a 510K and clearance under that process. So it's really important while you're thinking about getting to the market quickly through these abbreviated pathways in the context of the pandemic, to also be thinking about your longer term strategy, because sooner or later you're going to need that 510K or other kind of clearance or approval in order to be lawfully marketed in the United States. And before I turn back to Maitel, I just want to say that, so this is the kind of thing that all of us here at Holland & Knight, we've been helping literally dozens of companies, including companies that are Israeli, as well as companies that manufacture products in other countries outside the US, successfully bring their products into the United States through customs and lawfully marketed and distributed. We've got companies right now who manufacture hand sanitizer or surgical masks or masks for industrial uses and ventilators and all of those kinds of products. And we'd be happy to have any conversation with folks as a follow-up or to answer questions. And with that, why don't I turn it back to Maitel.
Thank you so much, Michael. And I would really like to take this opportunity to thank my partners, my co-chair Ron Klein, my partner Michael Warner, Ethan Jorgensen-Arp, and Jackie Williams, and to our partners EY, my dear friend Itai Zetelny, Shelly Diamond, and Martin Duifsozen, for the opportunity to collaborate on this important issue, as well as the Israel-America Chamber of Commerce. And to thank you all for taking the time to participate at this webinar. And before I'll turn it over to Shelly to wish you all safety and good health. Shelly, you're on mute.
Apologies. Firstly, yeah, I'd like to thank Senator Coons, of course, and Holland & Knight for their very informative and insightful webinar. Being an optimist, I'm a firm believer that humanity will emerge stronger and smarter from this coronavirus. And I also believe that from every crisis, new opportunities arise. Besides being the startup and innovation nation, Israelis are also renowned for their chutzpah, as many of you know, and rapid adaptability to changing situations. I believe these characteristics really afford Israeli startups to quickly adapt and leverage the prospects that were presented to us today. I therefore see a major opportunity here, and I'll be happy to assist companies who see relevancy to their business strategy. And just to clarify, I will be the contact person from EY for any further follow-up. On that note, I do wish you all health and safety, and let's hope for a prosperous rest of 2020. Thank you.
Thank you, Shelley. Meital, I think the floor is yours. So we ending the session, and I think I also want to join Shelley and thank you all for organizing that. It's really, I think we are old friends and it's our first joint. I remember we did conferences, but this is our first virtual conference. Very, very good experience from my side. So thank you for sharing with us. And I think that's important information that we need to bring to our clients and to the ecosystem in general. I don't see enough Israeli companies connected to the federal level incentives and in general exposed enough to other opportunities in the US from the government side. And it's a kind of something that we saw as a disadvantage in this COVID situation. There were companies that enjoyed the PPP, but and of course they have local activities. But in regards to programs that are federal-led and connected more to solutions and technologies, we don't do it enough. So I hope it will be the first step in do more in the future. So thank you very much for all of your whole night team and all the best.
Thank you. Take care, everyone.
Thank you.
Thank you. Bye.
Bye. Thank you, Shelley. Bye.